the Aces Optimist Show with your host, Dr. Craig Morris.
Hi, everybody. Welcome to Aces Optimists, dedicated to optimizing human potential in the clinic of life. When we talk about excellence, we think about it, at least I do, in terms of professional life. Other aspects also, but especially our professional life. We're now getting towards 20 of our podcasts in the can, and we've had some really interesting guests, friends of mine, mentors of mine, proteges of mine. In the end, proteges end up becoming mentors and vice versa. It's interesting how it works. And we've also had a few great people who were excellent in multiple professions. I think that's rare. I think if you can really find excellence in one chosen profession, you've done quite a lot. But every now and then we come across people who seem to have lived multiple lives and multiple professional lives. And that is one of our guests today is exactly one of those types of people. And I'm going to start off with a little bit of a teaser. In the music world, in the world of rock, who won the Grammy for the best album in 1970? We have generally some good rock experts at our audience. And if you were to guess that maybe it was the Beatles for Abbey Road, it would be a good guess. They were in the running, but it wasn't them. It could even be Crosby, Stills, Nash, and Young for their eponymous album. And they were in the running again, not them. So who was it? Hey, everybody, please check out our upcoming Aces for Me courses. These will be held in Dallas, Texas, between May and November of this year. All DNS courses. We hope to see you there. Well, it was the great group Blood, Sweat, and Tears. Well, our guest today was both a great rock musician, excellent in his field, who then became an absolutely great rehabilitation chiropractor, a pioneer in both areas. So it's my honor to invite and to welcome Dr. Jerry Hyman to our podcast.
Thank you very much. Yeah, there's one thing you forgot about my expertise in the art of procrastination. So I have striven to the greater heights of.
Well, we have something else in common, I'm afraid, my friend.
Yeah, get in line, right?
So exactly where to start is no easy task with your history, but I think we should go back a little bit and talk just a bit about your excellence, your work in rock and roll and music and as a trombonist for Blood, Sweat, and Tears. Tell us a little bit about that.
Well, I was born at an early age, which gave me a great advantage, giving me time to practice and study. I grew up in New York, lived in Brooklyn, and my entrance into the music field began with accordion. My dad played accordion, and when I started to play, he started to pay me not to practice. So that began, I saw some value in that. Yeah, but it was a great advantage to grow up in New York City in particular. And there was a huge exposure to all kinds of music. Mm. Push comes to shove, I spent about 10 years in playing freelance in salsa bands, at that time they called it salsa dura, which means the hard kind of salsa music that mostly came from, there's New York salsa, which is a hard salsa dura. And then there's music that came from the islands. And I ran from band to band as a young lad, playing in music from the Barbados and from Cuba and from Puerto Rico, and got exposed to all that kind of culture and saw behind the curtain, so to speak. So I was appreciative of that. And like I said, about 10 years, I began to work with a little bit of studio work, got exposed to that. And I worked with other fellows who got on Blood, Sweat, and Tears before I did. And I was working with an R&B band. I think you have a picture of it somewhere in there. And went from that into Blood, Sweat, and Tears right after they had a change in personnel. So Al Cooper left, David Clayton Thomas came in, myself and a few others, and so it began. It was a lot of fun. In brief, the music work, I tried to get first into the classical world because I was studying that. And the chairs in the classical world is an expression that's called moss back, that the players who have been in that seat for so long that they have moss growing on their back. And to get into those positions requires a lot of patience and the kind of discipline that to this day I've never had. I relied a lot on good fortune and some small amount of talent, and additionally being in the right place at the right time, kind of like a Woody Allen Zelig thing. And that's really where I think I kind of fit in. I was present when somebody turned around and said, "Is there a trombone player on this plane?" And so, like they usually ask for a doctor, but there was a marching band in the tourist section, and they lost a trombone player. So I got to participate in that, and really I more or less backed into things as I continue to do in the chiropractic profession. I can't. At one point, I couldn't walk through a room without expressing my opinion if anybody would listen, or if anybody was there even. So I really enjoyed the process. I never endeavored to become anything other than present. So in that regard, it took a lot of pressure off the process of being a musician. That one of the things that's highly required is to be present and to respond to the moment. And it's a world of improv and ad lib and all of that, a lot of which chiropractic isn't. I would say that's the only allegory that doesn't fit across the bridge. But the one thing that worked for me was understanding the structure and how to hang the activities of playing music, what the rules are, if you will, and appreciating that they were universal and could take them into chiropractic and understand how that applies. And it's different because in chiropractic syllabus, there isn't anything about principles of what to do, of how to listen, how to see, how to interject, and all that kind of stuff. So I was able to do that.
Now a word from the great K, Mr. Kevin Weeks. Take it away, Kev.
Thank you so much, Doc. Are you an NHL fan? Would you like to be? Well, I'm Kevin Weeks, former NHL goaltender, current NHL analyst on ESPN, the NHL Network. And I've got an outstanding new podcast for you. Whether you're a diehard hockey fan, a casual hockey fan, or potentially a new hockey fan, be sure to check us out at Patreon at The Inside Edge. You'll find us there. We've got a lot of great interviews, one-on-ones, exclusives with a lot of people around the game, from coaches to general managers to players to agents, and we'll take you inside the game and behind the scenes. Look forward to seeing you there. Thanks so much.
You were a professional musician. You even performed at Woodstock as one of the leading bands at the time. So you had this incredible experience, but then sometimes fortune deals you a good hand, sometimes a bad hand. And you ended up having a health related issue that interfered with your ongoing music profession, right?
That is true. I hold the world record for having Bell's palsy on three episodes of that. So it puts my studio trombone career on hiatus. And in the course of doing all kinds of labor work and odd jobs, and some things to this day I can't even talk about, that I learned a lot about humility and about perseverance and about just putting my head down and doing as good a job as I possibly can, whether it's from washing dishes or digging a post hole or something like that. I figured out my own recovery from things I've learned in coming up, and took me about 6 years before I could play again. One of the times that I had Bell's palsy, I was an attendee in Czech Republic in Prague, and Vlad assigned me to a therapist. I had to give up my lunchtime. That meant no beer and no fried chicken. So I had to go to the clinic and work, and I forget her name, but she was a tall woman who was very kind and had hands like catcher's mitts. And she did what I later found out was PNF treatments to inhibit the overactive side and activate the affected side. And it was so absolutely relaxing that I would fall asleep. And she would shake me awake, and she said, you must stay awake. And I begged and pleaded with her to let me go back to sleep because it felt so good. And she said, no, well, I would have to tell Dr. Yonda about that, so you'll pay attention. Which was a great idea, because I learned. She obviously studied under Vlad and Carl, and I got a direct idea of what that kind of work should feel like.
So I think we need to fill in the audience just a little bit here. So that means after you were taken out of music, you moved towards a chiropractic profession. We ended up being at the same chiropractic school in Cleveland and Los Angeles. At the same time, you were one class behind me, and then you went into practice. And then all of a sudden, you became more interested in rehabilitation, and you got a chance to hear about these unbelievably brilliant clinicians in Prague, the Prague School of Rehabilitation, we now call it, with Professors Karl Levitt and Vladimir Yonda, and started having the opportunity to study with them for a few years. And as I mentioned before, you really you were pioneering in helping to bring brass really into rock and roll, into broadening the depth and the complexity of rock and roll. And now all of a sudden, now you're starting to bring the Prague School, helping to bring the Prague School into the chiropractic profession. Professor Yonda ends up inviting you and another colleague, Dr. Ron Lefay. You guys were among the first chiropractors to study with them in Prague.
True.
That helps. Now we're starting to catch up. And it's while you were in Prague that you were getting these treatments and having the chance to study and starting to lead the way and to open doors for the profession, so to speak, as we started to all follow you and to go study and integrate the Prague School of Rehabilitation's work into the chiropractic profession. Hey, everybody, please check out our upcoming Aces for Me courses. These will be held in Dallas, Texas, between May and November of this year. All DNS courses. We hope to see you there.
Very true. And in fact, we weren't invited. The first time I witnessed Professor Yonda was at Los Angeles College School, where
Yes.
where Levinson had put on a program where Yanda was a guest speaker. And I was thunderstruck. I have to say that. It was like my jaw bounced off the floor. I can't say that I understood everything, but there was a felt sense of you will follow this path. I
Yeah.
heard that it was involuntary, and at that point I began to kiss the hem of Yanda's frock and begged and pleaded with him to let me just witness, be a fly on the wall. And he said, "Look, even if you got there, we would treat you poorly," as he would say. And I said, "That's okay. I'm used to that." So,
Yeah.
so after some more crying on his sleeve, he said, "Well, if you show up, I'll get a place for you to stay." And I wanted a witness to this in case I never returned, so that I asked Ron LaFay to come join, because he was already administrative and teacher in the Northwest, taking care of that. And I knew Ron from LA when he was living there. So we went there. I stayed. Ron stayed for 2 to 3 weeks. I stayed 3 to 4 weeks, and the education was not in a syllabus format at that time. But he would assign us to through the day different of his therapists and watch them do the work with the patients. And it was rarely one-on-one. It was typically a small group. And at that point, 91-ish or maybe 92, I can't remember, he would let us be there. The therapist, as an aside, I have to say, they all spoke English perfectly. And on top of it all, they were all drop dead gorgeous. So it made our work there a little easier to attend. Yeah.
Well, I can attest that this is still true with the physios in Prague now with DNS, men and the women. I would say is true.
Yeah. Yeah, it was a lovely experience, and they did treat us very well, and began to look forward. And I wouldn't say it was a pioneer. I was more like a scout with a raccoon cap. You know, I viewed what they did. I witnessed it. I tried to pay attention, and it's like if you get a new puppy, you want everybody to meet your new family members, so to speak. So you take it around. And I was uncensored by my enthusiasm to have witnessed all of this. And I took every ounce of whatever I could do to, if you will, seduce my colleagues to get involved in all of this. I don't believe I had to sell it. I just had to explain it through the filter of my emotional impression of what that kind of work was. And I have no restraints. If I'm excited about something, I want to shout it from the rooftops in the most cohesive, clear, and compelling way, on a one-on-one, to say, we need to do something about this. We need to get other people to learn this and achieve a totally different filter, a different window in how to look at patients, how to interpret what their movements are. The only movements that we got, at least I got in chiropractic school, were out of orthopedic books. So they were fundamentally correct in a very coned in kind of way. And all of a sudden we go to Czech Republic in Prague, and they're looking at the way people walk and the way they lift their head and the way they comport themselves. And Yanda's, 5 vital elements, respiration and prehension and posture and speaking, swallowing, and chewing, and all these things have first and foremost a way to observe them that compels one to begin to form a working diagnosis that would improve function. And the whole Prague school is predicated on at least what I got from it, was to improve function. Function, by definition, is anything that we do.
Hey, everybody, please check out our upcoming Aces for Me courses. These will be held in Dallas, Texas between May and November of this year. All DNS courses. We hope to see you there.
So that the end result would be not so much to remove pain, although they did discuss that. They said the pain follows the improvement of function like a shadow, and that it will diminish as function improves. And much like Dennis Morgan said, his whole clinic, and we can talk about Dennis Morgan for a couple of hours at another time, but I used to travel up there as well to spend a weekend or, like 2 days at a time during the week and just be a fly on the wall in his clinic. And we introduced Yonda to Morgan.
And Dennis Morgan was a brilliant physical therapist.
And DC as well.
Oh, he was both a PT and a DC.
And so it was, Joanne Larique was.
I was just going to mention. Her, yes.
So she was there, and we got to know her. Joanne's the salt of the earth, and it is, you would never be able to. She would attend a ballet performance in bibs and work boots. She is so down to earth, and she was our teacher, you and I, and we loved her to pieces because we could actually understand her.
And just a historical standpoint, so Joanne Larique is both a PT and a DC, and her aunt was Maggie Knott.
Yeah.
Who was involved in the formation of PNF, proprioceptive neuromuscular facilitation. And Maggie Knott also was the one who added the neuromuscular aspect of PNF, because Herman Kabak called it proprioceptive facilitation, and she added the neuromuscular part in the middle of it. So, and she ended up teaching us PNF when we were going through our rehabilitation training way back then, right? It's a great history.
It was a great joy to be in a student of hers and in her classroom.
Yes.
One never felt the pressure to perform, only to understand and get it right.
And she taught and spoke so practically and so easy to follow along, to follow with, to learn with. And then I always quoted you many times saying that you would say, you don't do what I do, feel what I feel. That was one of my Jerry Hymanisms that I've used over the years. And she would exemplify that.
Absolutely. And to your point, when we were over in Czech Republic in the classroom, and one of our very good attendees was Don Murphy.
Hey, everybody, please check out our upcoming Aces for Me courses. These will be held in Dallas, Texas between May and November of this year. All DNS courses. We hope to see you there.
And Levitt was trying to teach us something about neck and shoulder PNF, he made a distinction between tightness and tension. And for tension, he wanted us to use the post-isometric relaxation aspect of it. And Don, who has fabulous hands and who has a collection of intelligence that'll fill any room, was attempting to follow Levitt's instructions. And Levitt walked up to him and slapped his hands and said, "That's way too much." And Don said, "I don't even think I touched him." and, and Levitt came over and had him put his hands, Don's hands on Levitt's hands to follow, to do the same thing. And we always, thought that it was a little bit of a mystery what Levitt could do. It appeared as if you were touching people.
For those of us that were honored to study with Professor Carl Levitt, having your hands slapped by Professor Levitt was, in the end, a badge of honor.
Yes, absolutely correct.
Yes.
Yeah. He paid attention, and some of his therapists picked up his Levitt-isms when they would object to something, because we were mixed in and trying to come to consensus about how Yonda's movement test should be done and observed. So we broke it down and tried to objectify what, I don't know if you were there then or not. I have a memory like a steel sieve. I can't remember a thing. So the chiropractors went to one side and we tried to come out with an answer for what we're looking for and how to grade it, if at all. And the therapists were on the other side of the hall trying to do the same thing. And all we heard was a chorus of beautiful birds all singing the same song. No, 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 no. No, 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 no. They couldn't agree amongst themselves. They were all brilliant. But Levitt had also, if we did something incorrect, as you well know, he would speak the same words in that way, like a French waitress telling you, you can't get this liqueur with that coffee at this time of day. So it was a great experience.
I would say also he, if you did have, if you were corrected in any fashion, whether it was a hand slap or any other means, it always ended up with a high-pitched "no, no, no."
Yes, you're correct. That's great. Grand memories. It was a golden age.
Yes.
I feel privileged to have shared it with all of our colleagues and friends as we did. That's a once in a lifetime thing.
It was, but what you're saying, and with your description, I see, you come to life as I do, as we go back and we think about these times and these memories and the magic of it. But as a result, I think you made a very important point, because we didn't have any worries or concerns or feel any stress on trying to sell what it is that we were learning and integrating into the chiropractic profession. It only was a matter of like popcorn coming out of the pot, that it was just overflowing, was our enthusiasm. And at the same time, another part of us that was overwhelmed at trying to figure out how to apply it, but it was at the excitement of going and trying, and then also sharing with our other colleagues. And we were a group of chiropractors and physical therapists. Our first group of when we all went to study in Prague in 1994, or maybe perhaps 1995, as a group to study for 2 weeks. We were a group of chiropractors and physical therapists, and we learned in very short order how little difference it made. It made no difference. We were just all colleagues. And that included the very brilliant and great Claire Frank, who is also has done so well and been such a leader in the evolution of the physical therapy profession in America and internationally, and also as in DNS, also the second generation of the Prague School. And we also had Robert Lardner, who was also pivotal both through that whole era, and then also continues to be a leading authority in the world of DNS also. So what we've seen is this unbelievable evolution. But what we're talking about here is really for something to grow, for you to establish any kind of a high rise, you have to have that foundation, that solid foundation established. And that's really what we were involved with. And this is what you were critically important in establishing, Jerry. And on behalf of the profession, I have to say, and myself personally, I have to say thank you, because that really had a very big impact on me, your enthusiasm and your interpretations. And then the rehabilitation courses that you taught me, and you taught hundreds of others in courses around the country.
Yes. We, there's, I'm just recalling now two things. They have these observations about two strangers facing each other in a friendly environment, walking down the street, and somebody says hello and they smile. There is almost a mirror reflex that we're hardwired for. So if people start to genuinely smile, that we have receptors that can process that and can involuntarily smile back. It's the same thing with a genuine enthusiasm. You can't fake that. You can have people that are trying to be inoffensive or trying to create an atmosphere of relaxation. But I've been with band leaders that say, "Oh, just relax, 2, 3, 4," and it's not exactly a relaxing situation. But if you're in a classroom and your attendees are feeling comfortable with you enough that they feel that they can expose themselves to their weaknesses and vulnerabilities, that's the best way to learn something without being judgmental for that. You want to be in a place where you can really, be naked to your fellows so that they can observe and help. And this is what you're describing in that group. It's not it can't be a mandate for that all teachers are hysterically happy and joyous and come into the room with great enthusiasm. But there's enough that do, and those make a difference. When I was at Cleveland, I had a small group, I think it was 2 years of the interns when they were in the clinic. And if, pardon the expression, but there was about a dozen of them called Jerry's Kids.
I remember. That's when you were an assistant professor there at the school.
That's correct. Yeah. I don't know how they punked me up so high because, I tried Gary Globe, our esteemed clinic director, who is brilliant.
Yes.
Said, "Jerry, you can do whatever you want, just don't get caught." Because we know that everyone is not on the same page. And being promoted up to as assistant professor, whatever that was, made me a little more visible, which I thought was very nice. I got the appropriate pay raise for that, which was nothing, and then continued to move on with Jerry's Kids, which was essentially some compressed version of the course that you and I had suffered with, over the years.
Yep.
It was very good. I enjoyed that. I love teaching. I love learning. I hate taking tests. So when I was teaching, I said, "You will be graded on my observations of," and I already told them this at the end of the term. I said, "There is no final, but I will make a final judgment about your participation, as I recall, as best as I can." And they liked that. Some were scared shitless about it, but everybody who was in that class did participate to their fullest extent because I vetted all the interns that were participating in that. And it was a great joy for me. They willingly gave up, after school hours to do that. And I think what happened was, now, I don't know, I graduated in 80 something, and I'm still.
I can tell you.
Oh, okay. Well, I am that old. And but I'm still getting phone calls from people who were in that class who have gone on. And it just thrills me no end that they got the fire. They got.
Yes. Without that first generation and that enthusiasm, we certainly wouldn't have a second generation, and the continuing evolution and the growth of the model that was initiated back there
Yeah.
in the late 80s, early 90s. We have only one U.S. chiropractic program, in my knowledge, on a private setting, but the only academically organized setting for rehabilitation residency is the one that Dave Juring has, who was a recent guest on the show, and his postgraduate rehabilitation, and his resident who goes through, I think that's a 1 year, but maybe a 2 year residency in rehabilitation there at Palmer, which is in many ways the extension of the original rehabilitation program established by B.J. Palmer back around 1905, 1906.
Wow.
That they started. And when BJ was asked, why are you doing this and why are you setting up this program? He said, when the adjustment isn't enough, then we need this. And this was brought to my attention in the photos of the clinic. I'm very thankful to Dr. David Seaman for bringing this information forward and to me with both photographs and explanation of Dr. B.J. Palmer's interest and his focus and his establishment of that initial chiropractic rehabilitation clinic. But it would still be nice to see, I would love to see some sort of an expansion of your dream still, where we had more rehabilitation, more organized training. They do have, after graduation, the chiropractic graduates have to spend a year in a clinic in order before they get their license.
Right.
And there is a system where the clinicians, those that have the clinics, it is subsidized for them to be able to have and be able to afford to bring in these graduates so that they can get their training. And I really admire that in the European system.
Absolutely. I think that's a fabulous idea. I'd love to see. I remember Dave Juring sitting next to him in some of the classes that we were taking. I can, Big Dave, and and he's a clever guy, really smart, insightful, and just pleased as all get out that he's got his shoulders behind this. So that's great.
Yes, no, he's done a fantastic job, and he's been a great leader in 21st century rehabilitation for the profession, and then also becoming a DNS instructor and integrating that into the clinic, into the instruction, and into the courses there. And I've enjoyed co-teaching courses with him over the years, and look forward to doing that again in the future.
Yeah.
So then let's kind of circle back around to my initial statements. You've had this incredible life experience, multiple life experiences at the highest levels of the music industry and as a professional there, and then also into the aspects of rehabilitation within the chiropractic profession, integration within the Prague School and the first generation. What would you say were your main inspirations that led you to these levels of excellence, which I would call excellence, which you probably wouldn't, because I find People in my podcast very often are very humble, but I say it very easily. So what do you think were your main inspirations?
It, in brief, it kind of fits into uh, how I get through my day for the last 200 years or so. I go by something that John Hannon used to talk about.
Another colleague from the first generation, the great Dr. John Hannon.
Yeah, fabulous hands and brilliant, brilliant guy. But he and I used to teach together, as you know, for
Yes.
sure. And most of the attendees called us the Zen brothers. we, they loved being in front of us, but they couldn't understand a word we said. So we had a great time doing that. But the thing that he brought in, he said, if it's possible, you should try and get a felt sense that what you're doing goes beyond your touch, your intellect, what your eyes tell you, what you observe, that it all fits into a world that runs past the room. And I guess he never said that, but he implied that. And the idea that you can synthesize more things than most people. People are taught to do a certain thing, and that's what they do. It never gets much beyond that. But if you look at the advantage of having some training and other kinds of work, that if you can see the bridge to what you're doing now, just by doing that, you understand, like in music, if you play a 3 or 4 note consonant chord, if it's in tune, you hear partials and overtones that are not being played, but they insinuate, and then all of a sudden you hear something that isn't there, if you will. And it's the same thing with all the other things about touch and about vision and sculpture and fine art, that it's difficult sometimes for people who are not trained to see something, uh, get something from what they're seeing. And they go to a museum and they start to cry, or they start to feel something, or they laugh, and they go home and they try to figure something out. I will say, and this is actually attached to your question, as a little boy, my sister went to a high school where the combo was playing at a thing we used to call sing, where the classes would put on little skits and shows and sing and do stuff like that. And off in the corner, with just the little tiny music stand lights, was the small band that accompanied all of this. And without being told, I told myself at that time, I'm going to do that. No, and that's all I needed. That was it. I just began to feel all of that. And the same thing when somebody goes to a chiropractor for the first time. I would say some people would have the idea that they have to explain what the benefits of what they're experiencing is. We're doing this adjustment so you can appreciate nerve flow in places that blah blah blah. But if you're good enough, you could ask them, what did you feel? What did you get from this? Where do you think this is going? What do you want to achieve? How do you think we can do that? And I tell my people who I work with, I say, this is 50% of what you do and 90% of what I do. And they get homework. And I went to Dennis Morgan one day and I said, Dennis, I think I'm failing. I said, I'm only getting about 50% compliance in the homework that I give people. And he said, huh? Yeah. He said, that's about it. And he said, that's about as good as I get. You're doing great.
Yes. It reminds me of a wonderful quote of Professor Levitt, where he said, the capacity of a patient to go and alter their prescribed exercises knows no bounds.
Yeah. Great. I know, great imagination and invention. I took an entrance exam to Manhattan School of Music. Part of the exam was dictation, where somebody sits at a piano and they play chords or a tune, and then all the participants in the room claim to write down what the instructor is actually playing. And when you've reached your limit, you bring the paper up. It didn't take more than about 4 minutes before I was standing up and turning my paper in. And the guy says to me, Mr. Hyman, this is a dictation class, not a composition class. So he nailed me, you know.
Hi.
So again, what's the thing? It's felt sense, it's passion. If you're not making mistakes, either you're perfect or you're doing nothing.
Yes. In preparing for today's podcast, I was thinking what lessons you've taught me, and I realized excellence is a habit. And it's a habit overflows into our professional life and into our personal life. But in many ways, the word that kept coming back to me was the word that you just utilized also. And that's the word passion. And what we feel is that it's the passion that fuels our enthusiasm. And that enthusiasm fuels a hunger and an excitement. And with that, then it's not work, which is why I haven't felt since I earned my license back in 1982. I have never felt that I really worked. There was work involved in it, but I didn't feel as though it was something. It was something that I was just working my passion, sharing my passion. And so people might say, well, you put in, working 7 days a week and you're putting in 10 or 12 hours a day. But I didn't feel that way. Well, I work all the time. Yes, I guess I do, but all I'm doing is doing what I love. It's what I do. It's what I am.
Perfect. Absolutely perfect.
Yeah.
Well,
You've also shown this marvelous adaptability, because most people, if they can find excellence in one professional lifetime that they're passionate about, they're extremely fortunate and extremely accomplished. But what you're showing us is this capacity even to bridge different areas. And so, there's a little bit of, for example, my earlier guest that went from the world of sports, and then we're going into for example, in healthcare, like Neil Kazakowski, who was a professional pitcher and now is an excellent, brilliant student at Parker College. But there's an overlap a little bit with sports and then sports rehabilitation and all of that. But music to chiropractic and rehabilitation is a pretty big stretch. And what you've shown, though, is the same foundational principles of discipline, of enthusiasm, of passion, and hunger, then takes you down that same road, and you end up at excellence.
Yeah.
You have done this, and I want to thank you for the lessons you've taught me, the enthusiasm you helped to share with me and infect me with rehabilitation in those early stages. And I feel there's just a few that I feel that were chiropractors who were really very, very close and spent lots of time with Vladimir Yanda. And I was fortunate to follow you.
Yeah.
Really just a few of us, because we lost him. I met him in 1993. You met him a few years earlier, but we lost him in 2002. So it turned out we had this precious window,
right,
of which we did our best to try to glean as much information and knowledge and his expertise to share as we could. And I think, we've done our best, and it's been our honor.
Truly said. Well said. I agree. And I'm sure as I hear his voice over my shoulder, whispering in my ear from time to time, I don't know if you remember Tearful Tuesdays in his office when he closed the door and opened up the files, and it was dissection without anesthesia, for his interns and residents. And really, so no, once you see how much he can take someone apart, you really don't want that to happen to you. So, we know everyone brought some game to it. And I agree. Once you have that, once you feel like your hands on your students' hands are the most powerful guarantee that the work will be continued.
And with that, I'm going to invite you back. I would like to do a part 2 somewhere down the road, and we can talk a little bit more about that. And I think we could talk some more about the lessons we learned from Yonda. But at this point, we're going to have to sign off for today. But thank you, Jerry, for joining us. Thank you, everybody, for joining us. And we'll see you next time on Aces Optimus. Bye-bye.
Thanks for tuning in to this episode of the Aces Optimus Show. Catch you on the next one.